Hi, good morning, Mr. Scott. My name is Anthony, and I'm from respiratory care student from the respiratory care department. What I'm going to do today is I will be extracting blood. So, this test is what we call an arterial blood gas. So, the doctor ordered you this one because we want to assess your oxygenation, if how well your oxygen move to your different parts of your body, and also your response to the therapy or treatment. So first is I'll be assessing you first, checking out your vital signs, and at the same time I have to check your ID band with it to ensure that you're the correct patient and with the proper identification. So once I'm done, I am going to wash my hands and then wear gloves, and also if possible we have to wear goggles to prevent from exposure directly to our eyes, or even gloves or mask, sorry. So now I have here my device, so I'm going to set it on the side first, and then first is I have to explain it to the patient that what they have to do. So I'm going to do first a modified Allen's test. So I'm going to let the patient extend their arms with a paper towel or tissue roll underneath it, and then I have to let the patient close and open their fist for about 3 times, and then with me occluding the radial and ulnar artery. So once they're done with the closing and opening of their fist, I have to remove my finger from the ulnar artery, and then I have to notice if there are proper circulation of it or collateral circulation with their wrist, or if you notice the test to be negative, we have to switch it on the other arm. So once we notice that this arm is has a proper circulation, so we're going to prepare the device. And then another thing is when we go inside to the patient's room, as we will every RT will check patient's chart, we have to check some important details, such as if the patient is taking up anticoagulants, blood thinners, edematous, diabetes, or even like if which one is their non-dominant or dominant arm. For example, if the patient's dominant arm is on the left, so directly we will extract blood on the other arm or their non-dominant arm. So moving on, I'm going to prepare the necessary items, such as the needle, EBG kit, alcohol prep pad, the safety cap, band-aid, gauze, where we're gonna put this one, the biohazard plastic, and the label, and even the stopper. So I'm going to position the patient's arm like this, hyperextend. Make sure you will able to palpate the pulse, and then remove the needle. And then when we remove the needle, it should be very safe to accident poking by yourself, and then set the tube the appropriate amount, and then we have to position it. Well, it's like assuming we're holding a pencil or pen with a 45-degree angle, and then we have to have it bevel up. So when doing that, before proceeding when taking up the blood, we have to do a alcohol prep pad, clean it first. We have to do it with a circular motion. So when it's clean or dry, we have to now position our needle. Should be a 45-degree angle, and then once you notice that this is the pulse, we have to insert or puncture it directly. This. So you will notice a blood going inside. So once you notice the blood to be there, you have to set pressure on it with a gauze, clean gauze, and then if appropriate, we have another set of gauze to remove some air or tiny bubbles or even tiny clots, and then we have to put it on a stopper, and then the stopper should be removed together with the needle and dispose it in a sharp container. So for example, if the needle is already gone, we have to put the this one with a safety cap, make sure it is tight, and then if the patient is on not on anticoagulant, we have to put pressure on it by about 3 to 5 minutes. But if the patient is taking up blood thinners or anticoagulant, we have to put pressure or apply pressure for more than 10 minutes. So once you're done, we have to put a band-aid on it, and then it should be about 4 hours or more to prevent from any exposure or even infection. And then we have to put label on it, on the plastic. The label should be having a patient's name, temperature, FiO2 and also if applicable your initials, and even